Patients will consider private surgery for a number of reasons, and optometrists that refer patients for private surgery also have a number of reasons when they're considering making the referral. The classic and the most common is that there's a much lower waiting time than there may be in another healthcare providing facility. So a short waiting time is a very common reason. But there are several other reasons which some optometrists and patients may not be completely aware of, and I think are worth mentioning. One is that there is a choice of lens implants available when seeking cataract surgery privately, and that includes monofocal as well as multifocal lens implants, non-toric and toric lens implants as the broad categories, and then there are some other specialist lenses which may be used less commonly in specific situations. So a monofocal lens implant classically looks like this and is the equivalent of a single vision spectacle lens, so it allows people to see in one distance, usually far away, and then they have to have glasses for reading. And multifocal lens implants look something like this. There are other varieties and types from different manufacturers, but there are zones of different focal points for distance vision as well as near vision, and with some multifocal lens implants there is a middle distance focus as well. So multifocal lenses give the ability for patients to see far as well as near without glasses most of the time. So that's quite a big difference in category. And then there are non-toric as well as toric lenses. Patients who do not have astigmatism will need just a standard non-toric lens, whether it's monofocal or multifocal. Patients who have astigmatism, which is an asymmetry in the shape of the cornea, which can cause a degree of blurring or ghosting of the vision. Patients who have astigmatism would be better off receiving a toric lens after the cataract has been removed. Now, toric lenses improve the visual quality once the surgery has been performed and allows the patient to see better without glasses than with glasses. If a patient who has astigmatism does not receive a toric lens, then they will need glasses to correct their vision all of the time. So there's a range of lens choices that are available. Another reason to have considered private surgery is that the surgery is usually conducted by the consultant surgeon themselves, and the preoperative assessment is done by the consultant surgeon, and all the lens planning is performed by the consultant. In particular, the surgery itself is performed by the consultant. There's no training program in private hospitals generally, and so surgery would not normally be performed by a doctor in training. The training programs are absolutely fine and they're well supervised, but when a patient goes to a consultant for a private operation, they know that they're choosing the surgeon, the flexibility of the timing is in their hands, and they know that the surgery will be performed by the consultant of their choice. And so they are broadly the main reasons that people consider having surgery privately. I think it's very important that anyone considering cataract surgery or refractive lens exchange surgery is aware of the number one mistake that people make before they have their surgical intervention. And it's a mistake that people only know about, really, once the procedure has been completed. Please provide your contact details to us and we'll ping you over the answer straight away.